my name is Haley, and today I'm going to be demonstrating an appropriate bath of a newborn. So there's a lot of things that should be checked on the newborn before even initiating the bath. Number one is you want to perform an assessment of the newborn. There are several things to assess. I'm going to start with the fontanelles on the head. So you should check the anterior fontanelle, which will be about right here. That'll be diamond shaped. It should be flat and soft. It should not be protruding. Next, you'd want to check the posterior fontanelle, which will be kind of in the back around the occiput. That should be a triangle. That should also be flat and smooth, soft. Another good thing to check is the ears. You can pull the ears forward and let them go back, and they should immediately bounce back like they would on mine. Next, I will move to the mouth. You can open up the infant's mouth and you want to check around the gums. You'd be looking for these things called Epstein pearls, which are little white round calcium deposits commonly seen around the gums. After that, I'm going to auscultate a few different things on the baby with my stethoscope. So I put my stethoscope on. First, I'd be listening to his respirations. Sorry, not respirations. I'd be listening to his heart rate. I'd be listening to the apical pulse on the left side of the chest. I will listen to this for a full minute. What I'm listening for is any adventitious sounds or any murmurs. I'm also listening for a pulse of 100 to 120 beats per minute. Next, I can move to the right side of the baby's chest. And that's where I'll listen to respirations. Because their heart is so big, you can't hear respirations very well on the left side of the chest. On the right side, I'll be listening for a respiration rate of 60 to 80 beats or respirations per minute. And again, I will listen for the full minute there. Some adventitious sounds such as crackles may be noted. Crackles are normal to hear in the first hours of the infant's life because they've just come out of that intrauterine environment that was filled with fluid. So as they're adapting to the extrauterine environment, which is outside of the mother's womb, it's getting used to not having fluid in the lungs. The lungs are still learning kind of how to breathe on their own. They're getting the surfactant in use, and the alveoli are starting to work on expanding. After that, I'm going to be listening to bowel sounds. So I'm going to listen to all 4 quadrants. And bowel sounds should be audible and active in all 4 quadrants immediately after birth, or very soon after. After I've auscultated, I would check the baby's temperature to make sure it's appropriate before I perform the bath. I'm checking the axillary temperature, which is around the armpit. So I would stick my little probe there, make sure his arm is closed. The baby's temperature should be at a minimum of 97.6, 97.7. However, an appropriate temperature for the baby's bath would be 98.4, no lower than that. Also, some education for the parent. If the baby does have a lower threshold for fever, so if the baby's temperature is 100.4, a physician should be called immediately. If I've got the appropriate temperature, I can go ahead and start the bath. And before I start, I can check a few things on the limbs. So I can check around for the little folds on the palm. The baby should have multiple folds, not just one straight line. If it has one straight line, that could be called a simian line or a simian fold. That is indicative of Down syndrome and should be reported. I can also check for 5 fingers and 5 toes. When I'm checking the baby's feet, I can also check for the little folds on the feet. For the full-term baby, it should have folds on about 2/3 of the foot. Now I can initiate this bath. So I should have 2 towels with me as well as 1 washcloth. The hospital has adult towels. It doesn't have little towels for babies, so it's okay to have adult towels, and as long as they're folded and expose the mouth and nose so the baby can breathe. One thing that can be done in the hospital too is the towels, the washcloth, as well as the baby blanket can be put in the warmer before starting the bath. That way you can prevent evaporation and you can promote a neutral thermal environment for this baby. One other important thing to note is the water temperature. That should be 100 degrees Fahrenheit. The parents can take home something known as a bath buddy from the hospital. That will be like a little dipstick you can put in the water and check for the appropriate temperature. It'll have markings on it saying too cold, okay, or too hot. You want the temperature to be okay, which is the 100 degrees Fahrenheit. That way the baby can stay warm while you're washing them. Okay. And another important thing to tell the parents is when you're washing your baby, you want to make sure that you have the only areas exposed on the baby are the areas that you're washing. The baby can get cold very quickly, so it's important to keep the rest of the baby covered. What I'm doing with my washcloth is making a mitt. That's an easy way to dip into the water so I can just wipe the baby. I've got their head exposed right now, so I would start with only water to begin with. I would dip my mitt, and I'm going to take one nice swipe here. Sorry, I'm going to redo my mitt. There we go. So with the bath, I'm going to start at the eyes, and their eyes should be closed with only water, and I'm going to wipe from the eye to the top of the ear. I will do the same on the other side, the eye to the top of the ear. Something you might see on the baby is called vernix caseosa, which is kind of that white cheese-like substance on the baby. It doesn't need to be completely washed off with the first bath. It does provide a lubricating factor to the baby's skin. It's honestly better than lotion. It doesn't need to be washed off right away, as it is a normal finding. It might be washed off by the second bath. So now that I've washed my baby's eyes, I can go ahead and add some baby soap to my water. That'll be something like Johnson & Johnson baby soap, something that's really soothing to their skin, no irritants in it. After I've added my soap, I can dip again. And you just want to pat. You don't want to scrub the baby because that could irritate their skin. You're just going to pat to wash. You may be able to do like a little swipe back here, just around their hair. Okay, when I've got the head washed, I can move the towel down a little bit. I'm going to wash under their chin. I'm going to expose the left extremity here. Little wipe, around the fingers. I'm going to cover that up, expose the right extremity. Wipe. Okay. I'm going to go ahead and roll the baby onto its back here. I'm going to roll it towards the camera, but otherwise I would be rolling it, the baby away from me. What I'm checking for on the back while I'm wiping is I want to look for any inflammation or irritation around the buttocks, maybe like a diaper rash, or I could also be looking for a little sacral dimple, which will be right here. If that is noted, that could be an indication of spina bifida, which is also important to notify the physician. So wipe, wipe, wipe. Flip the baby back onto its back again. I'm going to expose the trunk here. And wipe around the umbilicus. One thing important to note with the parents especially is the baby will still have the umbilical cord on. It'll be clamped. When washing the baby, you should avoid around the umbilicus. Avoid washing it around that area until about day 5 when the cord falls off. You want to keep that area dry and wait for the cord to fall off until you wash. So in the meantime, just go around that area. Make sure to keep the umbilicus dry. The abdomen looks good. We'll cover up our baby and expose legs. Actually, I forgot. We have to do pericare. So the main thing, wipe from front to back, avoid that risk of a UTI. One thing to note too, with the boys, you want to be checking around their scrotum, see if the testes are descended or not. If the baby is uncircumcised, you do not want to retract the foreskin. Those foreskin really should not be retracted at all until about 3 or 4 years of age. With girls, you might see things like a swollen labia or pseudomenstruation. The swollen labia is a normal finding, as well as pseudomenstruation, which will be like a bloody discharge around the baby's vaginal area. That is normal right after birth with females because it's a withdrawal from mom's hormones, and that should go away. Next, I'll be moving on to the lower limbs. So expose a little leg here, pat down, pat around the feet, cover them back up. I've got my last little foot here. Pat down, and my baby is washed. Put my washcloth down here. Something the parent should know is the baby only should really be washed every 2 days. Sorry about the clock in the background. Otherwise, the baby doesn't need to be washed super often, unless he's got like a dirty diaper. Otherwise, really every other day is what's recommended. After the baby is washed, you continue pat dry. Again, keeping them covered and warm. After that, it's a good time to ask the mom or the dad even if they'd like to do skin to skin. Skin to skin is a great way to provide thermoregulation for the baby, as well as bonding between the caregiver and the infant. If they do not want to do skin to skin, that's when you can go ahead and put a diaper on them and clothe them, get them all swaddled. So I'm going to show how to do a diaper. So I've got one of my doggy's diapers right now. It's obviously way bigger than a newborn's diaper. Also, the tabs go in the front with my dog's diaper, but with a newborn diaper, the tabs will go in the back. So I'm going to fold this down to fit my little koala. And go ahead and put the diaper on. I'll go right up front here. The way the diaper should be put on the baby until the cord falls off is it should be folded under that cord, so it doesn't cover it, it doesn't let any infection grow. It should be exposed until the cord falls off around day 5. So you just want to fold under the umbilicus. The tabs won't exactly work with my puppy diaper the way I have it on right now, so I'm going to fold. But the way you would do that is you would pull the tab out from the back and tab toward the front. And that would be done on both sides. One thing I forgot to mention when assessing the baby is you want to be checking for symmetry in the facial features as well as the limbs. Make sure the legs are both the same size, same length. And be checking that features are symmetrical on the face, like the ears, eyes, nose, mouth. So once you've got your diaper on, the baby should be clothed with whatever the adults are wearing, so the adult clothing plus 1 layer, because babies have trouble staying warm. I don't have clothes for my little koala, but I can show you how to swaddle. So you'd want to get the blanket in kind of a square shape, like such. Put the baby down here. The baby's head should go towards the top corner of the square. You want to fold this way. And you can fold the bottom part up, like such. Then you can fold that side over. And tuck that little guy in. And baby is swaddled. Once the baby is swaddled too, it should also have a cap on its head to preserve some of that heat. And there's my baby. So education I provide to the parents, I kind of provided some throughout, like how the towel should be handled, only exposing what's being washed, avoiding the umbilicus region, checking the baby for any rashes, any irritation, keeping the water a good temperature, 100 degrees, making sure the baby is 98.4 before bathing, otherwise the baby could get too cold. Also keeping that towel on while bathing to prevent evaporation, which could cool the baby down. I think the last thing I would like to cover is a neutral thermal environment, which we've done part of that throughout, like keeping the baby covered, keeping them warm, warming the blanket, keeping the water a warm temperature. The parent should know that whatever apartment, whatever house they're in, the baby's, their living area, it should be kept at 68 to 72 degrees to promote a neutral thermal environment. That allows it to be warm enough, but not too warm, and on the flip side, also not too cold. The baby is still adapting to the extrauterine environment outside of the uterus, so it's taking a little bit to get used to that temperature, but on the flip side, you don't want it to be too warm because the baby could have trouble adapting later. Also with promotion of the neutral thermal environment, that includes the clothing plus one layer for baby. The baby's crib or bassinet should be kept away from any windows or doors, anything that could create a draft when opened, or that a breeze could get through, because that could also cool off baby. Struggling for words a little bit. I remember. The last thing that I should tell the parents to be aware of is when the baby is put down to sleep. So if they don't want to do skin to skin after bathing, they just want to lay baby down in their crib. The baby should lay on their back to reduce the risk of SIDS, sudden infant death syndrome. It is proven, or evidence-based practice shows that when the baby is on their abdomen, that increases the risk of SIDS. As well as being on their back, there should be nothing else in the crib with baby. It should be baby, their clothes, their blanket, that's it. And I think that's it. Thank you.